Hi everyone, welcome back to this weekly segment at Sejok Home Clinic. I'm Dr. Lavraj Sundar, the chiropractor here. So today's topic will be on headaches. I'll be talking about 5 different headaches: tension type, migraines, cluster, sinus, and cervicogenic headaches. So I'll talk about what they are, what kind of symptoms you usually get with these, and what you can do at home to help relieve of the pain that's associated with these headaches. So the first one is tension type. This is very common, especially with today's workplace and daily stress, I guess, of life. So a lot of this happens, you get in the neck here, and you get, most people say you get a tight band pressure around the forehead, and most common triggers are stress, and it can occur daily or sometimes weekly. So for this, a lot of it has to do with the muscles in the neck and area. So at home, what you can do is, if you're getting a tension headache, you can basically, just sit straight, and you can like bend forward, bend back, and then take your hand and just like kind of stretch to the side, and like this. And what this does, it helps kind of relieve all the pressure from here. And then also, you can also even take your fingers and rub in the temporal areas as well, because it usually occurs around this area. So that's the first type of headache. Second one is a little bit more severe, the cluster headache. This is one-sided usually, around the eye. It's a really throbbing, deep kind of pain. If the nerve gets affected, the trigeminal nerve, some people get watery eyes, redness, even swelling in the face. It occurs, more men get it than females. And it's called cluster because sometimes people get it 1 to 3 times a day, and it can happen for 2 weeks, and then all of a sudden it goes away. So this is a little bit more intense of a pain. Unfortunately, that there's not many exercises you can do, but there are natural remedies that I can tell you guys about. So the first is to increase magnesium, vitamin B2, even melatonin, and capsaicin cream. It's a kind of a hot type of relief cream. You can put around on the base of the neck here and some of the muscles around, and that can decrease the frequency of these types of headaches. Okay, so the third one is sinus headaches. These ones, you get deep pressure pain in the cheeks, in the forehead, and the nose. A lot of the times it's due to a sinus inflammation. Most people, even if it's here, you can get watery eyes as well and swelling. And it affects, usually in the winter or changing of the season months. And for this, you can do the same thing. You can take your fingers and rub in the sinus area. So like here, if it's here, you can rub hard in the cheek area, and the nose, you can kind of apply a little bit of pressure here. Another thing you can do is basically take the thumbs of your hands, and then I'll just turn around so you can see. So you're gonna basically put your thumbs here, and then basically you're just gonna do an acupressure kind of thing, and you're gonna, rub deeply. So you're gonna do like this on your head. You can do this 1 to 2 minutes, 2 to 3 times a day. So you can kind of, give yourself a type of like a massage, but especially with the thumbs here, it goes right on the muscle, and you should get some relief with the sinus type of headaches. Okay, so the other one is the migraines. So I know a few patients have chronic migraines, and with migraines it's different from the other headaches because you get nausea with it, vomiting, you get extreme sensitivity to the light and sound sometimes. Most migraines you get trigger, so either something will occur before and then you get the migraine after. So it could be some type of food craving, flashing lights. A lot of people complain about flashing lights in their eyes, or they start smelling some weird smells, and then you get the migraine after. This usually lasts 4 to 72 hours. For the most part, you need to be in a dark room and let it pass. But at home, what you can do is you can just drink more water. You can stretch the same muscles, like I was saying, kind of go side to side, and you can also do the same rubbing pattern. That can give some relief for the migraines as well. Okay, so the last one is the cervicogenic headache. So what this basically means is a headache stemming from the neck. So it occurs with movement. So a lot of people, they get the headache when they move their neck in a certain direction, and chiropractors are great at treating these type of headaches because we specialize in the neck and back area. So the neck muscles, for sure, we can help relieve some of the tension in that area. And for this too, it's a lot of the times it is from posture or trigger points in the muscles. So if you work on those muscles, you get quite a lot of good results with that. And what at home you can do as well, you can do like shoulder rolls like that, forward, backwards. And then you can also go kind of looking down to the left, right, and then kind of put some pressure on the neck there and do the other side as well. And you'll notice that I get like a nice stretch in this area. So that's something that you can do at home for that. So if you have any more questions, feel free to contact us here at Cervicogenic Clinic, and we'll be glad to help you. So hope you enjoyed this segment. Thanks.